Welcome, Hyde community. My name is Julia Kempner, and today we will discuss the COVID-19 vaccine. I want to welcome Dr. Jacob here, who is the Vice President of Medical Regulatory Policy and External Affairs at Urban Health Plan. Dr. Jacob oversees 9 school-based health practices, 2 family practice sites, and shares responsibilities in managing 6 school-based dental practices for Urban Health Plan, Inc. Thank you, Dr. Jacob, for being here today. I also want to welcome Hyde's Director of Student Family Support, Miss Elizabeth Hittenmark, or as we know her, Miss E, who will provide translations to the questions sent in from the Hyde community. Today, we will start with an overview of the COVID-19 vaccine by Dr. Jacob, and then we will answer the questions sent in from the Hyde community.
Good morning, everyone. So my name is Dr. Jacob. More importantly than the long title that I have is I'm a pediatrician that actually has worked at the Hyde Middle School Elementary School campus. So I've probably seen many of your children, especially if they've been in the building over some time. So it's an absolute pleasure for me to be here and talk a little bit about the COVID vaccine. Next slide, please. So what everyone sort of starts off very first up is it safe, right? Because that, everything seems like it got rushed. How do we get all of this up and running and stuff? So what I want to tell everyone is no steps were skipped. The real big important thing is that all of the usual safety steps that are taken for any vaccine, any medication that has to be done, when the 2 vaccines that are currently available and all future vaccines in America will go through the exact same steps, which is why, although there are many vaccines in the world, we currently only have 2 vaccines approved in America. There are 2 major agencies that take care of this, which is the Food and Drug Administration and the CDC. So, but sometimes people think like it's the government, I don't trust the government. How can I be sure that, they're not forcing something on me? What I want to tell people is, although it's under the umbrella of these 2 government agencies, who sit on the recommendation panel are national experts who do not work for the government. They are experts in vaccines, experts in medicine, experts on the COVID, who work for all kinds of different hospitals and community health centers and other places. And they're the ones who actually look at the data and make a recommendation. And based on their recommendation, is where these 2 organizations make the decision about whether a vaccine can be or a medication can come to the market. Next slide, please. The other big question people want to know about is, was there enough of a diverse population that was looked at in the studies? And if you see both the vaccines that are currently available, the Pfizer vaccine and the Moderna vaccine, almost 65,000 people were in the initial trials, and the trials are still going on, so more people are being recruited as it goes along. From the initial trials, as you see, both trials had about a 10% African American population and somewhere between 13 and 20% Hispanic and Latino community. So it was a pretty well spread out evaluation of who was in the trials. The other thing people want to know is, well, did they test different age groups, right? So the older age group, the 55 and above, really are the highest risk of having bad outcomes from getting COVID, right? So a big chunk of their patients that they enrolled were people in the 55 and above age group. So 45% in the Pfizer trial, 23% in the Moderna trial. So they also had an age spread as they looked at the vaccine that affects different people. Next slide, please. So, everyone sort of goes, what is this mRNA? I've never heard of this mRNA. Is it going to mess with my DNA? Is it going to change who I am and stuff? And the simplest way to sort of explain what mRNA is, just think of it as a message being sent to your body, right? So your body itself is the one that's making the antibodies that help protect us from the COVID vaccine, right? So we're all used to seeing the little blue ball when we watch TV with the little red spikes, that's the COVID that we all talk about. Those little red spikes are what's known as the spike protein, right? So that's what attaches to our body. That's what sort of causes our body to get infected and get sick and things like that. So what both of these vaccines do is they sort of send a message to our body, sort of says, this is what those spike proteins should look like. So I'm not actually sending you the spike protein, but I'm just telling you what it looks like. And then your body generates its own immune response to that spike protein. And that's how it sort of gets ready for if, God forbid, you were really infected with COVID, now your body already has these antibodies that help protect against it in itself. So So there's nothing from the outside coming except this message on what the spike protein looks like. The other thing is the mRNA that's coming in actually is very, it sort of dies off pretty quickly. And, some of the additives that they have, the additives are very short, right? It's a couple of salts, a couple of sugar molecules, and a layer of fat that helps to cover the mRNA so it lasts long enough to get into your body and doesn't die off immediately. Right? So that's pretty much very limited stuff. So even if you look on the side of some bread or something we buy and the ingredients, sometimes there are lots of things, like there are 20 or 30 things in the ingredient list, right? On both of these vaccines, there's like 6 or 7 ingredients. That's it. So there are very few things in there that can potentially affect our body. Both of the vaccines right now, you have to get the same vaccine both times, right? So they require 2 doses. So if you're getting the Pfizer vaccine, you have to get them 21 days apart. And if you're getting the Moderna vaccine, you have to get 28 days apart. So those days is the minimum number of days you have to get it apart, right? So, let's say you couldn't make it to your appointment on the 28th day and you needed to come back 1 week later. That's okay. You don't need to start all over again. It's just that you can't get it before 21 days, typically. Right now, we also, unless there was some sort of shortage or some special situation, the recommendation is that you try to get the same vaccine both times. If you got Pfizer for the first time, you should get Pfizer the second time. If you got Moderna the first time, you should get Moderna the second time. Next slide. And as far as the studies have shown, both of these vaccines are very effective. And compared to many of the other vaccines that are out there in the world right now, these are probably 2 of the best vaccines that are out there. They offer 94, 95% protection, and it works the same. And like I mentioned earlier, they tested on different races, different ethnicities, different age groups, and has the same effect in all the different age groups. Next slide. So there are going to be side effects, right? So not everyone's going to have side effects, but some people are going to have side effects. Both of them most commonly have similar side effects, right? So where you get the shot, it may hurt, your arm may get sore. In the next day or so, you may have some fever or chills or muscle pain or feel tired. With the Moderna vaccine, you can also get lymph node swellings. Lymph nodes are like those things that sometimes pop up when we have a cold, under our chin or behind our ears and stuff like that. So that's just part of your immune system. Because your immune system is being activated by the vaccines, they sometimes can swell up. Right? So all of these things can happen. The day you get the vaccine is known as day 1, right? So most of these things start the 2nd day or the 3rd day. And almost everybody, so at Urban Health Plan, we vaccinated almost 2,000 people. And the people that have had side effects, with the first dose, usually in the 2nd or 3rd day, they're all back to normal. And with the 2nd dose, as we're starting to administer more of those, it actually seems to be a little bit more intense, but goes away faster, right? So the people that had side effects with the first dose, there's a chance that the second time you get it, you're going to get the same kind of side effects. It may be a little bit more intense, but it seems to go away faster, right? So for people who, it took 3 days to get over the first one, seem to be getting better after 2 days after the second one. So, I don't want people to be scared of the side effects. There may be some side effects, but it does go away. The other thing to remember is the side effects are just a sign that your body is working, right? So think about it like when you catch a cold, right? When you catch a cold and your body sort of, the immune response kicks in, you sometimes get a fever or you feel like you're tired or run down and stuff like that. So that's why you're feeling those same kinds of things when you get the vaccine. Next slide. So as with any of the vaccines, there's a chance that some people are going to have severe allergic reactions, right? The good news is there have been very few allergic reactions, right? So despite the fact that every time you turn on the news or you go on the internet or Facebook or whatever, all you hear people talking about is anaphylaxis, these severe allergies, there are very few. So there's actually even more updated data than this. So right now for the Pfizer vaccine, they've given out almost 10 million doses, and there are about 50 cases of anaphylaxis out of those 10 million doses. For the Moderna vaccine, they've given about 7.5 million doses, and there are about 21 cases of anaphylaxis in those people. Right? And most of those people already had a previous history of anaphylaxis to medications and injections and stuff. So it seems like there are, and I'll go into some of those details in a little bit, it seems like people that have a history of allergies, severe allergies to injections in the past, are typically the ones who seem to be having allergic reactions. Just to compare, right? Everyone's like, oh, I don't want to risk getting an allergic reaction. You know, it's too scary and stuff like that. Just to compare, just in December, there was 6.4 million people just in America who were diagnosed with COVID. Right? Of those, 77,000 people died. Right, so COVID itself is not a simple disease, right? It's not the cold. You don't, you know, it's not, you know, you may have some people who have very mild symptoms, and you're like, oh, you know, my cousin had it, my prima had it, you know, my abuela had it, and she did okay, so I'm not scared, right? But there were 77,000 deaths, and it's all across the board. It's young people, it's old people, it's healthy people, it's sick people. It's random, and that's what's scary about COVID. That it's so random about who gets infected and who dies. So that's why the vaccine is a very important part of us going back to our normal lives. You cannot get COVID from the vaccine. There is no actual COVID in the vaccines. You can't, you know, get COVID because you took the vaccine. It also doesn't cause any respiratory symptoms, meaning like, you know, you're not going to get a cough and a runny nose and all of those sort of things that, you know, you catch when you get a cold or when you get COVID, right? One of the more common symptoms in COVID is people lose their sense of taste and smell, right? That does not happen when you take the vaccine, right? So if you got the vaccine, it's not that instantly you're protected, right? So, you know, you may have gotten the vaccine today, but maybe yesterday or the day before yesterday, you were at the grocery store and, you know, someone, you know, you were near somebody who had COVID and maybe you got exposed. And now if you have, you know, cough, runny nose, you know, sore throat, you've lost your sense of taste and smell and stuff, you may have COVID. So you really should have yourself checked out by a doctor. You know, don't just assume it's from the vaccine. Next slide. So there are some things we don't know all the information yet, right? So COVID has only been around with us for about a year in the entire world, right? The vaccine trials have been around, you know, about 6 months or so, right? So some of these things only time will tell, you know, what the details of these things are. Right? We don't know how long immunity will last, right? The Moderna folks, who are the experts who are working on the Moderna vaccine, think that at least for a year, they're pretty sure that the protection lasts. After that, they don't know yet because it hasn't been that long that they've started the trials for them to guarantee that the protection will last, right? So we'll know more about it as more time goes on. We also don't know how safe and effective it is for people under 16 because they really weren't in the trials. And if you think about it, whether it's a medicine trial or a vaccine trial, many young, you know, parents with young children, people who may have like a lot of medical problems or very old, typically aren't running to get into vaccine trials, right? So there's a lot of healthy people that usually sign up for vaccine trials. So most of the people that were in these vaccine trials were also relatively healthy, relatively young. Right now, both Moderna and Pfizer are recruiting younger people, right? So 12 to 17-year-olds, and so that they can start doing trials on younger people to sort of see if the effectiveness is the same. And that's common of everything, right? So whether it's your Tylenol that you took at home or your Motrin, when it was first released, it usually starts off with healthy adults. Once we, you know, show that it's safe and effective in young, healthy adults, then they sort of spread it, you know, so they'll go to younger people, and if older people weren't in the trials, older people get added on, pregnant women get added on. So, you know, they do those other categories later on once they're sure that it's safe and healthy. That's something that's going to continue with this vaccine as well. The other thing we don't know is this vaccine and other vaccines, right? So, you know, if you had to get, let's say, the flu shot or a tetanus booster, and you need to get the COVID shot, right now, the recommendation is not to take it at the same time, right? Give yourself 2 weeks. So let's say you got your tetanus shot today, then you should wait 2 weeks, and then you can get your COVID vaccine. If you got your COVID vaccine today, you should wait 2 weeks before you get your tetanus. So the recommendation is to give at least 2 weeks between the COVID vaccine and any other vaccine. Next. So just because this is where they tried it on, so the Pfizer vaccine is currently approved for people 16 and above, and the Moderna vaccine is approved for people 18 and above because that's who the trials were on currently. Next slide. So there are some special categories, right? So if you have a COVID infection right now, right? So you got your COVID nose test, and someone told you that your COVID test was positive, then the recommendation is you should not right now rush to try to get a vaccine. You should wait to stay home, isolate, get better, and then get the vaccine. It's not that the vaccine is dangerous if you had COVID. It's just we don't want to have people that are infected with COVID now standing in line or coming to a clinic or a health center to get their vaccine and infecting other people. Right? So we want to make sure you stay home for the 10 days minimum, get better, and then you can get your vaccine. If you had the COVID infection in the past, right? So let's say last summer in March, April, whatever, right? You had a COVID infection, or you actually didn't feel any symptoms, but when your doctor checked your blood, you had antibodies to COVID and stuff like that. So if you had an old infection that you've gotten over and stuff, the recommendation is to still get the vaccine because the vaccine actually produces more antibodies than just a regular infection. So the belief right now is that by getting the vaccine, you actually extend your protection for a much longer time than just having the infection. The other sort of special category is if you've had COVID in the last 90 days, right? So right now, most scientists are pretty sure that once you get infected for about 90 days or 3 months, you have some level of natural protection from the fact that you had the first infection, right? So not that you can just stop wearing your mask and go running around like crazy and stuff, but there's some degree of protection that exists in people that had COVID in the last 90 days. Right? As you all know, right now there are less vaccines than the number of people that need the vaccine, right? So if it came to a choice where you had two people at home, one person who just recently had a COVID infection, and let's say maybe it's Abuela at home who's older and hasn't had a COVID infection ever, and there's only one appointment available, maybe Abuela should get that appointment because Abuela's never had that infection before, while the other person, whether it's their son, child, whatever, had a recent infection, got better, so they have some level of protection. So that's just a special category. Next slide. So the other thing is that there weren't very many pregnant and women that were breastfeeding in the trial. So there were a few women that became pregnant after they joined the trials, but they weren't pregnant when they went into the trials. So there is very limited data on the effects of the vaccine on pregnant and breastfeeding women. That being said, the two big expert groups on these subjects is the American College of Gynecology and Obstetrics. So they're the people that sort of make all the recommendations on how we take care of pregnant people. And the American Academy of Pediatrics, who makes all the recommendations on children and breastfeeding and things like that. Both those organizations have sort of said, as they sort of, their experts have looked at the data and sort of said, the way these vaccines work, there's no theoretical risk that the way the vaccine worked that would affect pregnancy or would affect breastfeeding children in any way. So they actually say that if you're in a high risk job, right? So if you're a doctor or a nurse, so a cleaner at a hospital, a grocery worker, some sort of job that puts you at higher risk of being exposed to people with COVID. Once you have a conversation with your doctor about your particular situation, it's probably safe to get that vaccine because, again, like I said before, getting COVID has its own complications, right? So it's a risk benefit, right? You have to sort of figure out your own situation, discuss it with your doctor, and if you're in a high risk situation, you may want to get the vaccine, and there's no reason why you cannot get the vaccine. The other special condition is if your immune system is weak already, right? So if you have HIV and you're not under control, let's say you have some lung problems and are on long-term steroids, if you just finished cancer medication, chemotherapy and stuff, and your immune system is weak, we don't know how much of a response that your body will make to the vaccine. So you can still get the vaccine. We just don't know how much of a response it will make. So that's just for someone to be careful about that. Just because you got the vaccine, you can't assume you got the 95% protection that the studies showed. The other concern that we've sort of heard on social media and news and things like that is like, oh, this is all made out of fetal material, right? So, my religious beliefs don't let me, get the vaccine because that's fetal material in there. There's actually no fetal material in either the Pfizer or the Moderna vaccine. These are all created in a lab synthetically. So there's no concern when it comes to that. Next slide. So these are the people who should be careful about getting the COVID vaccine. Right? So if you have an allergy to any of the components of the COVID vaccine, and most of the components, like I said, are common things, they're very unlikely that people are, even going to know what that is. The one thing that's in there, especially in the Moderna vaccine, is this thing called PEG, polyethylene glycol. And that's a fancy, weird sort of name, but if you've ever had to get like a colonoscopy or had to have your bowel cleaned out before you had surgery or things like that, it's that thing that they give you to drink for the night before that sort of cleans out your bowel. So if you've had a bad reaction to that in the past, you should not get the vaccine, because that is one of the things that's in the vaccine that actually helps to encompass the messenger RNA, so it doesn't die off too quickly when it gets to the body. If you had an allergic reaction, meaning you couldn't breathe, you had your lips swelled up, your throat swelled up, after you got the first dose of the vaccine, then obviously you should not get the second dose of the vaccine. So all of those people that I mentioned, the 59 in the Pfizer trial and the 21 so far in the Moderna trial, they all had the allergic reaction within 15 minutes. Right? So that's one of the reasons why once you get the shot, we don't actually let you leave till 15 minutes have passed. Right? So you're observed with us. If something happens, we have medication to give you so that we can give you your epinephrine, give you oxygen, give you steroids, get you to a safe place and stuff like that. All of those people that had those allergic reactions got better after they were sort of treated. Right? So if you had an allergic reaction to the first dose, you should not get a second dose. Now, some people had what's called a delayed reaction. So it's not as severe as that, right away I got an allergic reaction. It's 4 hours after the shot, or up to 4 hours after the shot. Some people get like wheezing or, trouble breathing, or they get like hives all over their body. So if they've had any of those reactions in that 4-hour window, then it's recommended that you don't get the second dose. Right? So there are two people who, after their first dose, if you had a problem right away, or if you had a less severe problem, but within that 4-hour window, then you should not come back for a second dose of the vaccine. The other big category people worry about is like, oh, I have allergies to food. I have allergies to, pollen and dust and trees and things like that, right? So that doesn't matter. You can still get the vaccine. As long as you don't have a severe allergy, like that lip swelling, can't breathe kind of allergy to an injection, so a vaccine that you've had in the past, or an injectable medication that you've had in the past, all the other kind of allergies, you can still get the vaccine. Now, what happens to you when you get the vaccine is we observe you longer. So, a regular person gets watched for 15 minutes, but if you have a history of allergy to anything, then we watch you for 30 minutes before we let you go home. So that's the extra level of protection that you need. Next slide, please. So it's important that there were, safeties as part of the trials when they went on, but the trials don't finish, right? So when the vaccine is released, it's not like the trials stop, right? So there's a last step called phase 4 studies, which is they continue to watch what happens to people over time. They also look, in the trials, as you saw, there was like 45,000 people that were in the trials, which is a huge number for a trial, but it's only 45,000 people. But now we've had almost 25 million people just in America vaccinated, and millions more around the world, right? So they continue to observe the data. So how do we know what these data are, right? So there are two systems in place. One has been always around called VAERS, and that's a system where either doctors or yourself, you go on this website, and if you had some sort of reaction to a vaccine that you're worried about, you report it to that website. There are experts who watch through all of those reports and then reach out to people if they need additional details. Right? So that's the old-fashioned way of how we were doing it. We were relying on people to sort of report themselves. The newer version that they've rolled out specifically for this vaccine is called vSafe. Right? So in vSafe, when you get your vaccine, one of the things that they should be helping you do is enroll in vSafe, right? So if they didn't, that's okay. You can either go to this website, or if you have a smartphone, if you take a picture of that QR code, that weird looking black thing on the bottom, it'll actually take you directly to the website. And you self-register, right? So it asks you a few information about, who are you, which vaccine did you get, what date did you get the vaccine and stuff. Once you do that in the first setup on the website, then you're getting text messages, right? So the first week that you got the vaccine, every day you get a text message. It says, hey, Viju, it's time for you to, tell us about how you're feeling. You click on the little link, it opens up a page, it says, and it starts off with like 3 faces, right? Are you feeling good, bad, somewhere in between. Once you pick that, it asks you some additional questions about, like, give me details. Is it fever? Is it sore throat? Is it whatever, right? So it asks you for some of those details, and there's someone watching it on the back end, right? So if people report more severe symptoms, someone's reaching out to them to sort of see how you're doing and, things along those lines. So for the first week, you get a daily check-in. After that, you get a weekly check-in for up to 6 weeks. Then you get another check-in at 3 months and at 6 months and 1 year to sort of get a sense of how people are doing after they receive the vaccine, right? So, and once you sign up after the first dose, you don't have to sign up again after the second dose because it already knows you're due for the second dose. So it starts again asking you, how things are going after you get the second dose. Next. So the other big question is, okay, now, some of us are vaccinated, so can we go back to normal? Can we stop wearing our mask? Can we, hang out with our family? Can we go get on a plane and travel everywhere and stuff? Unfortunately, the answer is no. So even if, let's say, everybody took the vaccine right this second, which is not happening, right? It's only 95% protected, right? And so we need to sort of see over time, what does the infection rate look like? Is it continuing going down before we can sort of make those recommendations to, ease off some of those restrictions? But the reality is it's going to take time, right? So it may be till the end of this year, early next year, where we get many people vaccinated, right? Because of the supplies meeting up with the number of people that need to get vaccinated. The other thing is, both the vaccines were studied for that they prevent you from getting sick. They really didn't study in the vaccine if I can still carry the virus and give it to someone else. That just wasn't one of the things they focused on the first part of the trial. Now they're looking at some of those stuff now, but it wasn't something that they focused on. They really wanted to see, when I get the vaccine, is the person who got the vaccine protected? So there's a small chance that even though you're protected, you may pass it along to other people if you got exposed in the right situation. So we need to continue wearing our masks, continue wearing our PPEs and social distance. And you've probably heard recently, both Dr. Fauci and the health department in New York has sort of suggested, if you're going to be in an environment where you're going to be closer together with people, or you're going to be in a place where there's a higher risk of transmission, you should consider double masking, right? So not just a cloth mask and a surgical mask, or two surgical masks, or whatever combination you sort of want to think about. So double masking does have additional protection. Next slide, please. So in general, in New York right now, there are these two categories that you're probably hearing about, 1A and 1B, right? So there just isn't enough vaccine to give it to everybody right now, right? So there are people prioritized to get the vaccine first. The big category, easy to remember, everyone over 65, eligible. As long as you live in New York, you're eligible for New York vaccines. If you live in another state, you have to get vaccines from that state. Right? So age is simple, 65 and above. The 1A category is primarily people that work in healthcare, right? So, and when they say healthcare, it's not just doctor, nurse, it's everybody in the hospital setting that may come in touch with a patient, right? It's the cleaning crew, it's the security guards, it's, if there's a valet who parks the car, all of those sort of people that may have some sort of contact in that hospital healthcare setting is eligible, right? The other 1B category is people that are first responders, so the police, fire, EMS, et cetera. It's educators, so teachers, principals, people that work in school buildings that are in direct contact with children, they're eligible. Bus drivers, MTA workers. So, if you're in a public transit system, you're eligible to get vaccines. The only sort of other big category of public-facing people are grocery store workers. So not other store workers right now, grocery store workers. If you have a type of job that involves you being in contact with people, you're eligible to get vaccines. The big question that comes, well, where do I get the vaccines? And that unfortunately is a ever-changing situation, because as you probably have heard in the news and stuff, right now, New York has almost zero first dose vaccines left. So we're waiting for additional doses to come from the federal government. The easiest way to find it is you can call 311, or if you have access to the internet, if you go vaccinefinder.nyc.gov, that's the New York City, or Google COVID vaccine in New York City, it'll take you to that location. And they have locations that have vaccines appointments available. Right now, most places have been instructed by the state to only make appointments in 1 week slots, right? So if I get 100 doses to Urban Health Plan on Monday, then I can only make 100 appointments. And those appointments, every organization has their own sort of priority structure. So at Urban, for instance, we're trying to prioritize our own patients who are 65 and above. And then if there are slots available, it's open to community members like the staff at Hyde, other community partners, people that may work in other situations and stuff. Now, the governor has sort of said that hospitals and federally qualified health centers like Urban Health Plan should primarily focus on healthcare workers and their own patients. Right? The local health departments in New York City, the city health department is really supposed to focus on the other categories like police, fire, EMS, educators, et cetera. And then 65 and above, more and more local pharmacies are going to start receiving their allocations. So you can check in with your local pharmacy to sort of see if they have appointments available. So they're trying to sort of break up which category goes where so that everyone can still have access without having to all sort of, get mixed up in the same. Next slide. Perfect. So thank you guys for listening, and we'll go into some questions.
Thank you so much, Dr. Jacob. That was very informative presentation. So these are some questions that the Hyde community sent in about the vaccine. So the first question, which you did touch upon briefly, is how safe really is the vaccine?
So the vaccines in the trials itself, there were almost zero major side effects associated with the vaccine, right? So side effects are different than dangerous events, right? So side effects we expect with almost everything, right? So if you took Tylenol, you could have a side effect to it. If you took Motrin, you can have a side effect to it. So that's an expected reaction to something. But dangerous, life-threatening sort of situations, there were almost none reported in the trials. Now they're continuing to monitor it, and I'm sure every so often you hear, oh, so and so in Florida took the vaccine and died, or so and so wherever. And what you have to remember is even if you did nothing, some percent of people will die or have develop a stroke or develop a thing. So once those kinds of reports come in, they're trying to figure out, was it related to the vaccine or just something that happened randomly at the same time that they got the vaccine.
So, la primera pregunta que han hecho es que si la vacuna es segura. Y el doctor Jacobs dice que siempre hay problemas, pero la vacuna es sí segura. Más segura que si no la toman, pero a veces hay problemas con gente que tiene alergias, pero por lo tanto la vacuna es segura.
Perfect.
That's the short version.
Yep, no, that was perfect. That was actually perfect. Next slide, please.
Oh.
Okay, our second question was, why do we need 2 doses of the vaccine?
So what the first dose does is get your body, ready and producing those antibodies. What the second dose does is make sure that that protection lasts for a long time. And if you think about it, many of us who have children, we bring our children to the doctor, 2 months, 4 months, 6 months, because they're getting the same vaccine, but each dose is giving you longer and longer term protection.
So, la segunda pregunta es que ¿por qué necesitamos 2 dosis de la vacuna? Es como cuando llevan los niños al médico cuando están pequeños. La primera vacuna es para prepararlos. La segunda vacuna es para mantenerlos. So, por eso es que la vacuna ahora es igual. La primera es para empezar el cuerpo, para preparar el cuerpo para la vacuna, y la segunda es para mantenerlos.
Perfecto.
Okay, our third question, does the vaccine protect against variants?
So right now, both the Moderna vaccine and the Pfizer vaccine, they feel very confident that it protects against the common strains that are in America, the new UK strain and the South African strain.
So, la tercera pregunta es que si la vacuna va a ser efectiva con los nuevos, dicen que el virus que está ahora entrando a los Estados Unidos. Y el doctor Jacobs dice que sí, que estamos más que seguros que el nuevo virus que está atacando ahora, la vacuna va a ser efectiva. Cool.
Good.
Okay, can someone who has been vaccinated transmit the virus to someone who has not?
So I think I'd mentioned earlier, this wasn't studied in the original trials, so we don't know yet. They're currently looking at seeing if people that have the vaccine can then infect other people.
So, la pregunta número 4 es que si alguien que tiene la vacuna puede transmitir el virus a alguien que no. Y esa pregunta todavía no podemos decir con seguridad que si eso es posible.
It's one of the reasons why we still recommend people have to wear masks and do all the other things to protect ourselves.
So, por eso mismo es que es sumamente importante que todavía tenemos que usar la máscara y protegernos lo más posible.
Does the vaccine contain the virus? I know you mentioned this in your presentation, but just want to
both the-
reiterate
yeah.
this again.
Yep, so both the Moderna and the Pfizer vaccine do not contain any virus in there. Right now, all of the viruses around the world that have been trying, none of them contain the live virus.
La pregunta número 5, que si la vacuna contiene el virus. Absolutamente no. La vacuna no contiene el virus.
How long does it take for the vaccine to be fully effective after you have received it?
So the best protection happens about 2 weeks after you've had your second dose, is the current thought.
So, la pregunta número 6. ¿Cuánto tiempo se toma para que la vacuna sea completamente efectiva? Esa pregunta, la contesta es 2 semanas después que recibimos la segunda vacuna, la vacuna es entonces efectiva.
Will the vaccine be mandatory?
So right now, there's no plan for the government or any government agency to make it mandatory. But down the line, there may be, private organizations that may choose to make it mandatory.
La pregunta número 7, que si la vacuna va a ser mandatoria. Ahora mismo no, nadie está diciendo y no se sabe, pero posiblemente que el gobierno en ciertas ocasiones haga la vacuna mandatoria.
Yeah, so not government agencies, only private agencies may choose to do that. Like, so, if you work in a private company, they may say that you have to be vaccinated.
So, no todo el gobierno. Es posible que algunas compañías privadas nada más podían hacer eso.
Can we travel after receiving the vaccine?
So yes, again, as long as you continue to use the same safety protection you're doing now, so continue to wear masks, hand washing, and all of those sort of things, because that's not going away for a while.
La pregunta número 8, que si podemos viajar después que recibimos las vacunas. Sí, pero siempre con las mismas, tenemos que usar las mismas precauciones, siempre con la máscara, lavándonos las manos, usando la cabeza y teniendo cuidado.
Exactly.
When will children be able to get the vaccine?
So right now, since they haven't really had studies on children, more likely than not, it probably won't be till 2022. So maybe adolescents may get it later this year, but children in general may not be eligible till about 2022.
La pregunta número 9, que cuándo los niños van a poder recibir la vacuna. Por ahora no se sabe, posiblemente los adolescentes posible, pero no se ve posible antes del 2022.
How can we get the vaccine? Can we go to Urban Health?
So, I think I mentioned earlier, there's no good answer. I wish there was. So the best thing is try calling 311, try going to the vaccine finder website at the city. The state also has it. When they get more vaccines, there are going to be more of these like 24-hour, 7 days a week kind of locations like the Jacob Javits Center, like at, big armories and things like that. So they're going to be larger things in the future, but right now it's week to week and you have to sort of check with 311 or that vaccine finder website.
So, ¿cómo podemos localizar la vacuna? Podemos ir a Urban Health. Ahora mismo, como están las cosas recientes, vamos a tener que usar todas las métodos que podemos localizar. Ir a la computadora, llamar al 311. Me pueden llamar a mí, yo los ayudo, pero de todas las maneras que se puedan hacer.
In the future, there'll probably be, easier ways to get it. But right now it's going to be a little complicated.
Sí, no se sabe, ojalá que sea pronto, pero en el futuro pensamos que va a ser más fácil de localizar la manera de buscar la vacuna, pero seguir tratando, llamando en el teléfono, en la computadora, van a tener que tener paciencia, es lo único que le podemos decir ahora.
Okay. I think that was our final question. So thank you so much, Dr. Jacob, for answering our questions and showing us that really informative presentation.
Thanks, Ren.
Absolute pleasure. Thank you all.
Thank you.